Assalamualaikum and good day to everyone. My name is Jumberly Mimalhin and I belong in the Green Team. So for Green Team's topic, we're focused on the perspective on teaching and learning. So here, we are going to discuss the barriers to education, obstacles in learning, applying learning theories to healthcare practice such as principles of learning, learning theories, types of learning, and last one, the learning styles at different age group. So the objectives in our report is that we're going to identify barriers to education and then measures to overcome learning, as well identify the obstacles for learning and measures to overcome obstacles. And then lastly is to facilitate effective learning and teaching between nurses and clients. So here, for our first topic is about the barriers to education. So before we proceed with defining or going deeper into this topic, let us first look back the roles of nurses in teaching and learning. So we all know that as nurses, it is our job to teach patients about preventing and managing medical conditions. As well, it is our job to provide information, collaboration with the clients, as well together with the healthcare team. And then lastly is that in order for effective learning to happen, or occur when the nurses start to recognize the client's learning needs, learning style, and capacity to learn. So now let us define barriers to education and obstacles in learning. So and when we hear the word barriers, of course, it is the first term that would come into mind is something that would hinder or stop someone from doing something. And when we say obstacles, it means something challenges that someone may face in order to finish tasks. So in general, the definition of these two is that it is anything that prevents a learner from being fully engaged in the learning process. So basically, when there are stimuli that will barricade a learner to progress some learning process, then eventually this will stop them from fully igniting some information. As well, they'll have difficulty in gathering information to learning. So here we have different definition that focus on teaching and obstacles in learning. So first, we have barriers to teaching means the factors that impedes the nurse's ability to deliver education services. So an example of these factors may correlate within the environmental issues such as noises, lacks of space, or privacy. So here, obstacles in learning are factors that negatively affect the ability of learner to pay attention of process information. So example of here are some personal issues that the client may experience, or the nurses issue that or the nurses issue, like for example lack of motivation, lack of goal or purpose, such as like that will impede their ability to deliver health education. So here, uh, there are subtopics or types of barriers to education. So first, we have lack of time. So from its definition, it is correlated to the time management. So lack of time is a common barrier that prevents health professionals from being to carry out their educator role effectively. So means that there are some times as nurses that we find we it is hard for us to find time to allocate teaching, since it is a very challenging role. It is a very challenging for us, especially if mayroon tayong mga workloads, other workloads other than teaching the patient, and as well that um, there are sometimes na yung, for example, yung patient is nagkaroon ng schedule for this treatment, then of course when you are currently discussing health education to your patient, then masa-stop yun since schedule for time yun ng patient for his treatment. So basically that would relate to the lack of time in delivering necessary instruction towards the patient because of their lack of time during their shifts. So next, we have lack of confidence and skills. So basically, these are the nurses who don't feel confident and competent enough regarding their teaching skills. So here, sometimes it is common for us to feel anxious, as well as um, to feel not confident when in terms of delivering healthcare to our patients, is we fear that we may masasabi tayong mali, or may masasabi tayong misinformation sa patient na magkakos ng harm sa kanilang health status. So sometimes nurses who don't thoroughly study or overlook the case of their patient may feel not confident and competent enough to teach regarding um, their health education that they'll give to their patient. Next, we have negative influence of environment. So here, the environment setting in which health professionals are expected to teach is not always conducive to carry out teaching learning process. And we all know that sometimes there hospital, yung may mga hospital is may lack of private space sila for health education, since yun nga may mga hospitals na parang fully accommodated yung mga rooms nila, so there are no other space na maki-carry out nila yung delivery of health ed. So here, aside from that, meron din mga environmental stimuli such as noise or such as lack of space na ang isa sa mga dahilan kung bakit may negative influence sa patient na maka-focus sila during the interaction. So here, so lack of space, lack of privacy to teach is not always conducive to carry out teaching process, since there will be frequent interference such as client treatment schedules are factors that negatively affect health professionals to carry out effective interaction with their learners. So yun. And next is the absence of third-party reimbursement. So here is the meaning is that an absence to support patient education relegates teaching and learning to less than high priority status. So as I have observed, some hospitals parang nag-neglect sila sa importance ng health ed towards the patient. So since parang inisa lang nila doon sa discharge plan yung pagbibigay ng health education. However, due to lack of time, since may mga hospitals din na sabihin na wag na tayong magbigay ng health ed since kulang tayo sa manpower at kulang din tayo sa time, kasi alam naman natin na busy talaga sa hospital. So due to this is that hindi na na-highlight o na-priority ng isang ng mga healthcare teams ang pag-educate ng patient due to the absent support of patient education. Then last one is the questionable effectiveness of client education. So this is the state of being unsure whether patient is provided sufficient health education given by the health professionals. So this may relate to the lack of confidence and competence of nurses in delivering teaching skills. So when a nurse is not confident enough, then of course they will question their capability or the outcome the outcome of their teaching skills, and sometimes na mag-question sila if naintindihan ba to ng patient, nagets niya ba yung sinasabi ko, kasi there are times that even when a nurse is doing health education, there are times talaga na suwail yung mga patient and they will not follow what the nurse have recommended them to do. So here by the action of the patient, a nurse may question the effectiveness of the health ed that they have carried out to their patient. So that ends, or those are the kinds of barriers to learning. So next topic is the obstacles in learning, which will be reported by my other colleague.